used to sign just.
Oh, I see what you're saying.
I just thought you had yours out, but we could do that.
Are you okay?
We can do mine too, if yours isn't on. I have mine too.
I could just ruin the password thing.
I could either like that, but that's
What's just the number? Oh, no. Yeah. Wait. Let's change. Oops. I think it's like an important. Nothing in the field.
Your patient, let's do this. When you check your patient's blood sugar, it was, let's go ahead and say it was a 350. You didn't have the, call the doctor because you're going higher than the sliding scale. And the doctor gave you an order to give, let's say, 10 units of, is it regular insulin? It's on your list? 10 units regular insulin.
Yeah, we just had to do.
Did the computer stay on?
Yeah,
So right now,
cholesterol thing, and most of it's pretty high.
patient is what, 150? Then you call doctor first, and you do that order. You have 2 units of
I mean, it's the same thing, right? Like he's laying down, we take the vitals, and then want him to sit up, and then do vitals.
That'll be
We should.
Okay.
But remember, it was having.
And that's what it says when I just like Googled it. It's like, yeah, you go see the night first, and then have it like for at least 5
I
minutes.
just realized I said that.
Take them.
It's right here, I have it in
You have it.
living room.
Yeah.
Not doing anything today?
No, my husband's working.
Anthony. Yes, sir.
What's your email?
A.L. Wilhite?
A-L?
Yeah, A.L. Wilhite.
A-L will hype. How do you spell it?
W-I-L-H-I-T-E.
I thought it was military.
Valentine's Day gift.
I want to tell him. He's going to get like clear and concise for correct. Well, it's just when you're like relaying information or like.
This is repeat.
I mean, it's nice to feel better now.
Yeah. On the go.
I feel like I'm standing for a minute. Blood pressure. Yeah, there is too.
After like seeing the CNAs there, I'm like, we should have just done it.
Because we usually get twice.
To allow time to
3 times. So one time laying down, stand up for a minute, take it, 3 minutes, take it again.
It takes so long. Here's where it says the average convenience stand.
Which is really dumb.
Yeah, it's not that big.
For the
Where you're
updated
at, that's going to be improvement.
Well,
The goal is to
my
like.
sister-in-law did the same, and they still made her train from
Different.
St. Mary's, so I'm all over everywhere.
It's just like,
Our guy had like hypertension.
They only, usually like new hires, they have like 6 days, like 6 shifts of training.
and then if for some reason he starts to have
Oh my
Our other
God.
patient has a
Really?
different.
Yeah.
patient.
But I don't know. Cause then you have to too.
Yeah.
Or maybe I'll just.
I feel like I'm more.
I'm wondering about the E line. I guess we both look enough. Is it sodium chloride?
So each has a, is it has a order, so
Order.
it's like, do you get it?
Oh, then it should be in there, right?
I wrote
Oh, we
on
gotta
my
use the vitals. We gotta skip.
I feel like I get like to the.
Yeah.
I think that's just, like, on the tele, we just have all the things that they're on the continuous. For the ambulance.
Yeah, right.
It's hanging on there, so we'll simulate. We'll put it on the
And then I'm gonna go take this, I'll take it in my car and then we'll read rest. But now, I think so, I need to go school while you're talking, I guess. It's gonna have me. I'm like, there's.
You look good. It seems to be a big part of that. I didn't have a problem with flow.
You fixed it, you can go back in the other room.
Bye, guys.
Take your chairs with you.
I'm sure, thank you.
I should get his chair, actually.
Oh, now you're really nervous, huh?
It just, there goes our emotional support.
No more emotional support.
You guys will be fine.
We'll see.
Okay.
Okay. Yeah.
Can you get?
Is the mannequin louder now?
A little bit.
You can hear through there. Not real, I'll have to talk real loud.
Okay. All right, good luck, guys. You guys got this.
Thanks.
Can I hear? Say something.
Hello? Testing, testing.
Hello, Max. Max, can you hear me now? When should we do like assess the heart rate and all that? Should we go with cholesterol stuff first?
Yeah, I think we should just go around that. I mean, we can like check in, introduce ourselves,
I
check
think we
his,
should do his pain.
yeah, pain scale, and hypertension, someone else with hypertension.
Let's talk amongst ourselves to make sure that
Everything is working all right?
everything's good. You can hear us okay. I can hear you. That's a good thing. We just moved it back. You can? Okay.
It's like a ghost echo.
Yay. It won't be not real loud.
Yeah, no, not like usual.
So if he's supposed to have like sodium chloride running,
Really?
should we just assume that it's there?
Yeah.
Okay.
Well, they can hear you. Okay.
It's just delayed a little bit.
All right.
Do we get,
So Mr.
Renfro?
Max Renfro is a 65-year-old gentleman presenting to your clinic for evaluation of his high blood pressure. He is overweight and complaining of feeling tired and becoming dizzy on standing. And his wife, well, I guess he's supposed to have a wife, asked how she can take his blood pressure to keep track. Don't worry about that. So he's a hypertension patient.
Okay.
All right?
his medication, has he had anything yet today? The home, he's got
He's only got
home
the home.
medication, but that's about it.
He's had all of his home medications.
It's the furosemide and the blood pressure medication.
What you can do, actually, you can simulate this. You can hang with the sodium chloride. Make sure this is sodium chloride. Fentanyl, let's give him some.
Feeling rough.
Tom, you right down, buddy.
Yes, I know this is lactated ringers, but
I'll call it.
What do you need, Stacy?
normal saline.
NS? Okay, I have one. Hold on.
Do you? Okay. It'd be nice to do it right. Put all this in your feedback. They'll never get us all the stuff we need unless. Anyhow. Alright, so she's gonna get your normal saline.
Do we have a pump or are we just gonna?
No, you can just hang it by gravity. I don't know. Did we learn by gravity? Hi. Oh, good. She's getting us some normal saline.
Excuse me, can I ask?
She's getting.
People doing that.
I think I have.
You ever heard somebody blink?
No.
Muscle.
Thank you. And you just have gravity tubing. Oh, thank you.
Oh, here's one right there, too.
Oh, okay. He's out there looking for it. He, sorry, he found one in there.
Oh.
And they're in here, too.
All right. So you can just use this as hang it right out.
Should we do it as part of the simulation?
Yeah, just you're gonna hang his normal thing.
Okay.
All right.
Alright,
How do we hang this?
so go watch.
Alright, I'm ready when you are, guys.
Okay. I'll do this.
Ready?
Do we need to open it? Are we assessing that? Maybe put it in a pocket.
Knock knock.
Good morning.
Good morning.
Hi, Mr. Renfro. Good, how are you?
I'm Josh. I'm gonna be your nurse today, and this is April. You too.
Can you state your name and date of birth for me?
Sure. My name is Max Renfro, and my birthday is 11/13/XX.
There's not a birthday on here, but there's his name. I guess we're assuming the birthday's the same?
Yeah.
Okay.
Yeah.
Okay, great.
Alright, and I don't think we're on oxygen, right? Take this off for you.
So you were here because of hypertension, huh? And some dizziness?
Yeah, I was getting dizzy when I stood up,
Okay,
and I've been really kind of tired, like fatigued.
okay. Are you feeling that way right now or today?
I used when I stood up earlier.
Okay. Okay, so we're gonna do a couple assessments today. There's some orders for that, so we'll get to that. But are you feeling any pain right now?
No pain.
No pain, so 0 out of 10?
Correct.
Okay, great. All right.
I will.
So we're just gonna take some vitals real quick. We're gonna just check out your heart, lungs, and see how everything's feeling, okay?
Okay.
I'll lower the bed here.
What are you doing?
Whoa.
Sorry. We're doing it. We're gonna take
Your vitals in two different positions here.
Okay.
So we start with you laying flat. I'm gonna take your blood pressure.
I see here that you have some home meds. Are you taking those once a day?
Yeah.
Okay, great. And we're also going to try to get you moving today once we do the vitals, okay?
You got it.
151/88.
Okay, we're safe.
So that's pretty high.
Alright, and let's take your pulse here.
Can I bring that paper to write down?
Can I feel the pulse here? I'm just gonna- You feel it?
I know.
Can we go off the pulse on the screen?
Correct.
Okay. And let's see, do we have the pulse
Hold on. Just gonna get your oxygen levels here. I'm just gonna put this on your fingertip for a couple minutes. So take 95. That's the pulse ox.
I'm gonna get your temp. Do we have a temperature? Sorry.
98.
What was the pulse ox?
95.
And respirations. Which, never mind, I should have done that when I was doing this. I'm gonna check your pulse one more time.
Real quick, I'm just gonna check your toes here.
Okay. Respirations are 18.
Okay, it's a weak cat pulse, but there is a little cat pulse.
Okay, now I'm gonna sit you up slowly, okay? I'm gonna have you sit up for about a minute. And then we're gonna recheck your vitals. Is that okay? I don't wanna put the mannequin too far up. So we'll wait a minute.
Yeah, and then we'll do the ambulation after that. Get on cardiac, and then we'll do WD.
Yeah. Okay, so it's been a minute. Blood pressure again.
And then while she's doing that, I'm gonna listen to your heart sounds real quick too, okay?
30/68.
Okay, heart sound normal to me. Yes.
Can you take the pulse oximetry?
All right, one more time with this pulse ox on your finger. Got a little cough there, you okay?
Oh, I'm fine.
Okay. Okay, pulse ox is 93.
Okay, respirations are still.
How are you feeling right now? Are you dizzy or anything, or do you feel all right?
No, I feel fine.
Okay, good.
Now we have to wait 5 minutes, and then we're gonna take it one more time.
Okay.
Kind of a long process, yeah.
Just
No
wanna-
problem.
So maybe while we're doing that, I could start
The ceiling.
the ceiling.
Well, we got to ambulate too, so.
Okay, then we should wait.
But we can. I guess it's ready, huh? It's ready. We'll open this up there.
Is that it? Make sure you scan it in. Uh-oh. Do we listen to the lung sound, the breath sound?
I just did his cardiac, but yeah, check out his breath.
Okay, I'm gonna. Oh dear. Are you okay? Sit him up.
Yeah, so we're gonna go there.
Lay him down. Sit him up.
Okay.
Sit him up more.
You okay?
Yeah, I smoke, so this isn't.
Oh, gotcha, gotcha. Can I get you some water or something, maybe?
No, I'm alright.
You okay? Okay, real quick, can you just verify your name and date of birth again for me, please? Check this med here.
Sure. Map is Red Road, 1113 XS.
Okay, perfect. I don't want to do this
Do you
yet,
have
huh?
any allergies? Are we doing anything?
Do I have any allergies? Yes, I'm allergic to codeine.
Okay. Is that what the chart?
Yeah, I'm allergic to codeine. Gets urticaria.
Okay, I'm gonna listen to your breath sounds. If you could take a deep breath when you feel my stethoscope, okay?
So have you talked with anybody about your smoking?
Me.
Have you ever thought about quitting or tried to quit?
No.
No? I think it might be a good thing for you to do. We have people here that you can speak with about a good plan, especially with your hypertension and cardiac issues. It's one of the leading causes of making that get worse. So I think it'd be a really good idea.
Yeah, but it's hard. I've been smoking a long time.
That's what I hear.
I'm hearing something about his lungs.
Yeah. Like crackles or something.
Sounds like crackling. Up here. These sounds, do you hear it? Yeah.
I don't know if that's the mannequin or if it's the sound. It's going. Okay.
I'm gonna take his vitals again.
All right.
So what do I need to do to help my blood pressure?
What? Just the blood pressure?
Actually, what do I need to do?
Oh.
I'm asking what I need to do for my blood pressure.
Oh goodness. How's your diet?
Good, I eat all the stuff I like.
What stuff do you like?
What's your normal lunch and dinners look like?
Well, my wife is Hispanic and she makes some mean chimichanga. Oh, that's my favorite.
Oh, that sounds delicious. But we should you should probably be eating a diet with a lot of fruits and vegetables. Do you like any fruits and vegetables? Does she make any?
I like beans.
Like beans, okay. How about calabacitas? Does your wife make
I
that?
like peppers and onions in my carne asada.
Have you ever heard of the DASH diet by chance?
No.
No. So it's something that I think you should probably look into. We can get you a nutritional consult for that too, but this is very specific for hypertension and blood pressure, so it'd be great to eat that way. And it's like April said, there's a lot of emphasis on vegetables, fruits, but it gives you a whole list of options so that you can, it can still be fun and taste good and it doesn't have to be a boring diet. But
You can have poultry and fish and
Okay.
low-fat dairy.
But it'd be very important for you. It'd be very, very good for you to do.
You're also going to want to watch your sodium. You don't want too much salt.
Okay.
And then, do you like to do anything active during the day? Go on walks, hikes?
I play video games.
Video games, okay. Well, you'll want to try to maybe take some breaks and maybe go on a quick walk, about 30 minutes a day. And then the smoking.
It's a
If you
big
really
one.
want to help your hypertension, we'll need to see if we can get you on a plan to quit the smoking.
Quit smoking? How? I mean, that's gonna be hard.
It's going to be hard. There's medication that can help. There are programs that we can get you some information on that can help support you through the process.
Okay.
It's tough, but it's worth it. If you'd like to work on the hypertension especially, it's probably the best thing you can do for yourself. It's important.
Okay.
We can get you a consult too, and they can help kind of walk you through that and work out a plan.
Okay. That would be helpful.
Taking your medication regularly? It looks like you have
Yeah, I
something
took it this
prescribed.
morning.
That's good. That'll help with your blood pressure as well.
So even for breakfast, I need to change my diet?
Yes.
Yep. It's probably the most important one you can do too.
Okay.
Especially the salt. The salt content's a big one. You want to try to aim for a more low-fat diet. Good protein, but low fat, low salt.
All right.
All right. So there's one more order here to get you moving a little bit today. So have you been up and about at all?
Not since I came in.
Okay. So we will assist you. Are you able to walk on your own? Do you need assistance with a walker or a cane or?
No, I can walk on my own as long as I don't get dizzy.
Okay, so maybe we'll stand you up and we'll stay with you for a few minutes and see how you feel, and as long as you're not dizzy or feel okay, or maybe we can walk around with you a little bit too. But we want to make sure you continue to move.
Okay, sounds good.
It's
Okay.
important that we go slow.
All right.
So so that your blood pressure doesn't drop and make you feel dizzy.
And obviously you can't get less than one. So I think you guys are good. We can
Okay.
go back and meet the new theory.
Okay.
Okay, thanks.
You did a good job.
That was fun.
Did we ever get a sodium goal? We pretend?
We didn't have it out. Let's find out. Let's not talk about that.
Okay.
Wash, wash.
Flush. I did scoop it.
Okay, so I think what we'll do is we'll go ahead and we'll just kind of introduce ourselves. We'll kind of start talking to them right there and kind of start doing our assessment. Kind of from there.
Okay, Stan is new for the first time.
Yeah. Yeah. All right. Mr. Rowling! We don't hear you. No.
No.
Not at all.
No.
Unbelievable.
Is he asleep? Mr. Rowling?
Yeah. Hold on just a second.
Hold on, I'm gonna lower this down. This should not be up.
So.
We'll raise it up when we do it like this assessment stuff. No.
And you don't hear the monitor beeping, do you?
Mm-mm. Which vitals do you want to do?
I can do inspiration. You probably just up here to this bottle for me.
Okay.
Try to pulse ox.
Blood pressure.
Yeah. Or maybe I can do blood pressure. Just I don't know if you want to do the
Pulse pulses and, yeah.
Screw it, just stand at the door.
What's that?
I said, screw it, just stand at the door.
I know, it's not working again.
Because we gotta.
All right,
We
guys.
can barely hear the doggone mannequin anyway. If you stand at the door, we can probably hear you better.
Okay.
Can you hear us talking? Okay.
Let's go ahead.
All right. We'll start over.
Okay.
Mr. Rowling,
Yes.
my name's Dustin. This is my colleague Sarah. We're going to be your nurses today.
Kristen and Sarah, hello.
What brings you in today?
Well, I got really short of breath when I was mowing the lawn. My chest started to hurt, and it was really uncomfortable.
Okay. And how long did that last?
It lasted until I went and I had to sit down and rest for a while, and then it went away.
It went away. So it went away with some rest. Okay. All right. Mr. Rowling, before we go any further, can I have your date of birth, please?
518XX.
All right.
And do you have any allergies?
No.
No.
All right. And Mr. Rowling, do you know where you're at right now?
Pima Hospital.
Excellent. Do you know what year it is?
2022.
Okay. All right. Are you currently having any pain right now?
No.
No pain. Okay. Did you take any medication to help relieve the pain before you came in or before you called 911? Because I see you
I-
came in by ambulance.
I took aspirin.
You took some aspirin. Okay.
Yes.
How much did you take?
They couldn't hear me again. Yeah. Well, they gave me aspirin, 4 baby aspirin, and 3 sublingual nitro.
By EMS?
Yeah.
Okay. All right. Has this ever happened to you before?
No.
The chest pain? Okay. Can you describe kind of what you felt when you were starting to get the chest pain?
I just was mowing the lawn, moving, and can you hear me?
I thought I heard something.
And all of a sudden, it just felt like pressure and discomfort in my chest.
Okay. All right. Well, we're gonna do an assessment on you. We're gonna get your vitals. We're gonna listen to your heart. All right.
Sounds good.
So I'm gonna start by taking a listen to your chest, okay?
Okay, that's fine.
Lungs sound good.
Okay.
Alright.
I'm gonna take a look at your feet here, okay? While she listens to your lungs.
And
And
I'm
you're
gonna
gonna
listen to your heart.
notice bilateral edema.
Bilateral.
2+.
Okay.
Yeah, my feet have been kind of swelling up lately. I don't know what the deal is.
All right.
And down again.
Are you supposed to be able to feel the pedal pulses?
They're there.
Okay.
Yeah,
we can hear
Yeah,
you.
we can hear you.
All right, so he's got some 2+ pitting edema. How long haven't been noticing the edema in your legs?
Maybe a month or two, and it'll be worse some days than others.
Okay.
So his lungs and your lungs and your heart sound good.
Okay.
And I'm gonna check your blood pressure, okay?
Okay.
And I was palpating for his radial pulse. Does it match what's on the monitor? Okay. Is it regular or irregular?
Right.
Regular, okay.
And what's his blood pressure?
120 and however.
Pulse is 78 regular. SpO2 is. Okay. I'm going to check your oxygen level here. Did you have any difficulty breathing or shortness of breath when you were having the pain?
Yeah, I felt short of breath.
Okay.
I had to sit down, rest for quite a bit, and then the pain gradually started to go away.
Okay.
But then when they gave me the medicine in the ambulance, it totally went away.
Okay.
I think when they gave me the nitro, it really,
It really
I
helped
felt
you.
a big difference pretty quick. Each one, I felt a lot better.
Okay. All right. So looking at your history, I see that you have a history of hypertension. Is that correct?
Yes,
Okay. How long have you had the hypertension or high blood pressure?
years.
Years? Okay. All right. And are you a current smoker?
No.
Okay. Do you drink any alcohol regularly?
No, socially on occasion, but not a lot.
Okay. On occasion, like
Once every couple of weeks if we go out to eat.
Okay. All right.
Okay, I'm gonna check your capillary refill.
Okay. Whatever that means.
I'll be checking seeing if your blood flow is making all the way to your fingers.
Oh, okay.
Thank you. And I'm gonna check your toes.
Slightly delayed. He's got edema. He's got 2+ pitting edema.
All right. We're going to go and hook you up to the cardiac monitor here, since you're in here for chest pain. Let's see how your heart's doing, okay? Pardon my reach, we're going to put this down here. Where's the one with the legs? All right, there we go. What medications do you take on a regular basis?
I take lisinopril for my blood pressure, and that's really all I take.
Okay. How often do you take the lisinopril? Just
Once a day.
Okay. Do you know the dosage of it by chance?
I don't.
Okay. Okay, so we listen to your heart and lungs. I'm gonna take a look at, I'm gonna kind of do a more in-depth assessment, okay? I'm gonna take a look at your head and your eyes. I'm
Okay.
gonna feel around, tell me if anything hurts, okay?
Sure.
Feel around your sinuses here above your eyes. Any pain?
No.
No? Okay. Down in your cheek area? Any pain
No.
there? No? Okay. Open wide for me. Good. All right. Okay. And I don't see any nasal discharge, any irritation in your ears or nose?
No.
No? Okay. Ears look good. All right. I'm going to check your eyes now, okay? I want you to look at the tip of my finger, and I want you to follow my finger just with your eyes, okay?
Okay.
Very good. Any difficulty seeing my finger?
No. My only complaint is just my feet swelling and how I got feeling chest pain and really just short of breath. And
Okay.
fatigue. I have been more fatigued lately.
Okay. Well, the swelling in your feet and the fatigue and with the chest pain is a little concerning. We want to figure out what's causing that. Okay. So we already listened to lungs, right?
Yeah.
Okay.
And are you normally active?
Not so much.
Not so much. So it'd be pretty good to try to get in 30 minutes a day of walking or some kind of exercise to help with that hypertension. And
Yeah, but if I get feeling short of breath, you know,
right.
then I don't feel like I can walk.
Are you feeling short of breath right now?
No.
When you're laying here, just when you're moving around.
Yeah,
You're-
like
you're
when
feeling-
I'm really exerting myself, like when I walk all the way down the hill to get my mail and back up, I really start feeling short of breath.
All right.
I haven't been sleeping that well either. Get a little short of breath when I try to go to sleep.
Do you experience the short of breath when you're laying flat, or when you're
Yeah, I've been sleeping in my recliner,
okay?
and so that I can sleep better.
So you can sleep better.
Mhm.
Okay. Are you experiencing any abnormal coughing with the?
Sometimes I kind of have a little bit of a productive cough, but not a lot.
Okay. All right. Let's see.
I'm gonna take a look at your IV site. Looks good. Let's see.
What's his skin color and condition? Normal.
Pink,
Okay.
warm, dry.
Okay.
I'm gonna listen to your bowel sounds, okay?
Sure.
And listen to your stomach. Is it normal sounds? Okay.
What do you think's going on with me?
Well, with the edema with your edema in the legs, that's usually indicative of some type of fluid building up back up into your what's what I'm looking for? Just into the right side of your heart. That's what I was trying to say. Which would lead to you experiencing the chest pain. So,
Am I dying? Fluid's building up in my heart. Am I going to die?
so we're going to keep you from dying. We're going to prevent that from happening, which is why your heart is starting to give you some clues of, hey, something's going on. We need to get this fixed. With the edema, we want to start getting rid of the edema.
How do you do that?
So we would contact the doctor and let them know about the edema in your legs and associated with the shortness of breath. And they might prescribe something to help get the fluid out of your body. And it's usually administered either orally or through an IV, and that's going to help rid your body of the excess fluid.
And then I'll feel better?
And then you should start feeling better, because that excess fluid is putting extra pressure on your heart, and it's evident in your legs.
Okay.
So we're going to go ahead and give the doctor a call and let him know that you've got some fluid building up in your legs, you've got the edema associated with the shortness of breath and the chest pain.
Okay. So I think you guys are good. You are on the right track. Good job.
Yeah.
Go
Thank
ahead
you.
and you come in here and talk to everyone and
set them on the calendar next week.
All right.
Hello.
Good morning, Mr. Soros.
Good morning.
I'm Jackie. This is Nick. We're going to be your nurses today.
Jackie and Nick. Okay.
How are you feeling today?
I felt pretty good until I got on the scale.
Sure.
Apparently they're trying to tell me I've gained 5 pounds when I've been trying to, well, I haven't really been trying, let me be honest.
I was just going to ask, what things were you doing? Are you trying to lose weight or just maintaining?
Oh, he wants me to lose weight, says I need to exercise more, eat better, because I've got this type 2 diabetes stuff.
Sure. Well, before we start with anything, can you tell me your name and date of birth?
Sure. Nicholas Soros, whatever, XX.
Okay, great. All right, and I have here you have no allergies, is that correct?
Nope, no
All right,
allergies.
perfect.
And besides your other issues, are you having any pain right now?
No pain. Sometimes I get this like tingling and numbness in my legs and feet, but I don't have it at the moment.
Okay. That's something that can happen with diabetes if it's not well controlled. Do you check your sugars at home?
Only
Like
if I
your
feel
blood sugar?
crummy. Only if I feel crummy. I know I'm supposed to do it more.
Okay. What kind of numbers do you get when you feel crummy? Do you remember any of them?
Sometimes 240, 220.
Okay. Well, that is a little bit higher than we typically like it. Usually we would ideally like you to have your sugars between 70 and 110. And having your sugar be too high can be hard for like your blood vessels, hard for different parts of your body. It could be contributing to that numbness feeling that you're starting to get. Do you want to go over like diet?
Yeah, we can go over that stuff. I want to get some other
You want to assess first?
assessments
Okay.
done. Yeah.
Do you mind if we do a quick assessment on you real quick?
Please do.
Okay.
Okay. I'm gonna check his temperature.
Okay.
What do I see on this temperature? What's this again?
It's normal.
Normal. Okay.
I'm going to listen to your heart and lungs, okay?
Actually, I am kind of feeling that numbness and a weird feeling in my toes.
Your toes. Okay.
It's kind of painful. It like tingles,
Uh-huh.
pricks. I guess I would say that's like a 5 out of 10.
Okay. All right then. Check your capillary fill.
Should all be normal.
Okay. Check your pedal pulses.
Heart and lungs sound normal. Do you have any pain in your belly when I press right here?
No.
Okay, good. And then oxygen's good, heart rate's good. Any edema or issues?
No, just the numbness and tingling.
Okay. Numbness and tingling currently? Okay.
And I saw in your past history that you had I guess some knee replacements in the past, surgery.
Yes.
Okay. How long ago was that?
Oh, that's been years.
Okay.
3 or 4 years.
Okay. And in addition to your diabetes, one other history I wanted to ask you about is you have are you still a smoker? Some of your history that you.
No.
Okay.
I did quit smoking.
You did quit.
Okay, fantastic. All right. So we see here that you have been having some issues with peeing. Are you still having those issues, that burning and kind of feeling like you're not able to get everything out?
Yes.
Okay. And
I will check your.
we saw an order for a Foley. Does he have one? Let's see one.
Yes, let's see.
He does have a Foley.
So I'd check the color as well, just to verify. But so we're getting some pain, and burning, and is it looking cloudy or?
No.
Okay.
No infection.
Okay.
Bacteria.
All right.
So we're going to grab some of your medications for today. You do have some acetaminophen available if you're having pain. Do you feel like you're needing that right now?
Will that help that numbness and tingling in my feet?
It won't be affecting the numbness or tingling.
Then no.
Okay. Okay, we'll hold off for that for a while. If you're starting to have some pain later, let us know and we'll get that for you.
Okay.
Okay. So we'll be running back to get meds, but I wanted to reach out to the doctor.
Okay.
So one of my questions for the doctor is he has bethanocol and then oxybutynin ordered, and one is a cholinergic, one's anticholinergic, and I read oxybutynin can have an adverse effect of urinary retention, which he's already having. So are we still wanting to give
So
that med?
let's hold that and just give the
Bethanocol.
bethanocol.
Okay. And then with his admitting diagnosis of lower UTI, are we wanting to start antibiotics until we get that urinary culture back?
Yeah. Well, you can go ahead and start that. You can start antibiotics. Is there an order?
No, there's
Okay,
not.
then no, let's wait.
We'll wait, okay. Okay. So we'll go get the bethanocol and we'll be right back.
Just a botanical.
Do you want us to actually take it out?
No.
Just, okay.
Simulate.
Okay.
I've got your botanical.
Sorry.
We're also just gonna verify your name, date of birth, but we're just gonna.
While
Get
you
your
do that, I'm gonna
wristband.
grab his blood pressure. So
Okay.
we got that before. All right, Mr. Soares, I'm gonna check your blood pressure here really quick as he gets your meds set up.
And I'm gonna give you a glass of water as well to take with your meds. Okay. And like I said, the botanical chloride's just gonna help stimulate your bladder to help you get rid of some of the excess urine buildup.
Excellent, because that's really annoying when I can't go.
Mm-hmm.
Thank
Definitely
you.
understand. And so, with your scheduled medications, that's all we have for that. I know for your diabetes, you kind of seemed a little unsure of how to deal with that. I understand it's kind of a family history thing. Look at your charts. Your blood sugar is a little high.
Yeah, they said it was 200 and something.
Yeah.
286.
And while there's not any medications for that in your chart, we can give you some consultations. But for some immediate things we can do, we're gonna try to at least cut down on simple sugars and try to eat some more complex carbohydrates. Basically, I want to put in layman's terms that those high sugars and simple sugars are basically enabling your pancreas. It's easily uptaked. So
Enabling?
yeah, it's you're not allowing it to fully. I say enabling because it's kind of like you're not letting it do the work it needs to build up your natural hormones. So try to, like I said, really cut down on those simple sugars. Otherwise, we'll get you consulted with a dietitian, and we'll look at your medications that you can take for that.
Another thing to kind of put in perspective,
Yeah, you bet.
we did some lab work on you, and it was showing us, let me pull it here up here so we can tell you accurately, two of the things that we get in your blood work is something called a BUN, and the other is a creatinine. So BUN, everybody naturally makes nitrogen in our body. We make creatinine, and your kidneys are responsible for getting rid of them. Your blood work showed that both your BUN and your creatinine was high. So
What
stuff
does that mean about my kidneys?
So your kidneys are responsible for getting rid of those things. Like I said, we all make the nitrogen and creatinine naturally, and your kidneys are what helps us get rid of them. So if they're high, it's meaning that your kidneys aren't doing its job to get everything that we need out.
Why is that?
And that could be happening because of, with your diabetes, what I was mentioning earlier, when you have diabetes and your sugar's too high, it can be harming your delicate blood vessels, and you have a lot of blood vessels in your kidneys. So if your sugar's too high for a long time, it can hurt those little tiny vessels in your kidneys and start to cause problems.
Well, I don't want kidney problems. I have a friend who's on dialysis, and it's horrible. It's all he does.
I bet.
Wow.
So that kind of to help put in perspective of with the numbness and tingling, and now you're having this issue with your peeing, it's your body kind of telling you that you might need to make some changes.
Wow. No one ever told me that about the little vessels in the kidneys. I'm glad to know that because I don't want that to happen.
Yeah, definitely good to know. And there's, it's hard to know until you come in, and we can kind of help you out with that. So,
Okay.
like Nick was talking about, we can get you started with changing up your diet a little bit. Checking your sugars at home is really good to do consistently, so that you can know the food that you're eating is doing a good job, and that the medication that you're taking at home is doing its job.
Okay. That makes me realize how important it is.
Oh, good.
Okay, so how's the pain in your toes? So we could look to give you the acetaminophen if that would if you're still having a lot of pain.
It's not too bad. It's
Okay.
it's like tingling and numbness, really.
Okay. Let's see here. Yeah, other than that, like I said, there's besides the BUN and the creatinine we talked about that showing up in your urine, we saw something about proteins and blood, so definitely indicative of some kidney issues. And like I said, we'll talk to the doctor about getting a CBC ordered if there's some type of infection that we're not seeing as well. So.
Okay. Sounds good. Great. I'll meet you back in the room. Good job.
Thank you.
What was his temperature?
She's a normal. She said 98.6.
Okay.
I'll just give the same values you do, so it
Yeah.
matches.
Yeah, I'll write it down. Oh wait, you don't have to turn on this one.
Oh, you're right.
So-
Thank God.
Don't worry about it.
Yeah, awesome.